The recent UNAIDs report indicating mixed results in the campaigns to reduce HIV infection among key populations. In Kenya, the campaign to support key populations varies depending on the subgroup. For intravenous drug users, the efforts in place through the harm reductions program generating controversial perspectives stands as the only option to wean users of narcotics in Kenya's 3 major cities. Beryl Ooro brings us that report.
The United Nations is calling for renewed efforts that would see a decline in HIV infection among key population groups. For recovering heroin addicts, exposure to infection is a daily threat, which is broadened by lifestyle habits.
It is not possible to avoid using the drug. Without a little heroin to start the day, it is impossible to do anything because you start to experience serious withdrawal symptoms. So you always have to go back and use a little to get yourself back to normal.
Addiction. The drive to get one more fix has such a pull, and for addicts, nothing is too far or too extreme.
I was with some friends of mine when we stole 100,000 from a certain lady, and I was the one who was left behind after the crime. I was charged with the crime in court and I went to jail.
I have had to do a lot to manage this habit. I even got involved in crime. I have robbed and even conned people so as to be able to sustain this habit.
However, there is hope. The Wellness Center at the Jaramogi Oginga Odinga Hospital administers methadone as a replacement drug to addicts in the early steps of recovery to prevent the onset of withdrawal symptoms. Members enrolled to the project go through thorough screening and are accompanied to the site for a daily dose by a peer educator from the LVCT site in Manyata, Kisumu.
In Kisumu, we have a number of drug users who are injecting, but majority also are smoking. But those who are injecting are influencing those who are smoking to graduating into injecting.
According to Liverpool VCT, there are 18,327 known injecting drug users in Kenya.
There's not much in terms of advocacy for understanding better the concept of harm reduction. People are more into talking about supporting people who are under influence of alcohol, and their option is rehabilitation.
There are existing policy gaps that hamper the campaign's efforts and make for a tense relationship with security officials.
There are some few punitive laws which are against what we are doing. Example is when the drug user is caught with this paraphernalia, where the drug user maybe has a needle or a syringe in his or her pocket, and then unfortunately he bumps into a police raid, he will be arrested.
As peer educators, we still have to deliver needles to addicts to prevent them from sharing, because there are those who still share needles when using drugs.
Even with the existing need, according to the 2018 Global State of Harm Reduction, nations enrolled to the program have fallen from 90 to 86 between 2016 and 2018. Global financing for the program has also stalled. Even in the face of long-standing controversy, strictly adhering to the parameters of the program at the Wellness Center has re-established family ties.
We have asked Janet to avoid the bad company. We offer her financial support to ensure that she is not tempted to use the wrong means to earn a living.
I don't know what I would have done if the methadone program would not have been introduced.
The reality that 1/5 of the intravenous drug users worldwide have HIV and roughly half have tested positive for hepatitis C calls for renewed efforts to support infection prevention programs. Beryl Ooro, CGTN, Kisumu, Kenya.